Let's get oral. Let's get oral.
Hello, hello. It's Camille and Jonathan at Let's Get Oral again.
Let's get oral.
And today we're so excited to have Barbara Tritz here as a seasoned RDH. She's a very respected dental hygienist and educator known for her passion for advancing clinical excellence, patient-centered care, and professional empowerment within dentistry. She comes with a strong focus on prevention, education, and evidence-based practice. She's a very trusted voice in the hygiene community, and I'm thrilled to have her here. She's really pivoting in thoughtful leadership, cultivating conversations around oral health, and evolving the role of dental professionals. So I'm really excited to have you here. Hello, Barbara.
Good morning, Camille. Good morning, JD. This is an honor. Thank you.
Good morning.
Super happy to have you. We are excited for you to tell us kind of how you have evolved your practice. First, how you came to become an RDH, some of your learnings in the field, and what has driven you into the educational aspect. Really want to get your sense of having been behind the chair and what are the hurdles that you've had to leap through during this career.
Ooh, all right. That's a mouthful. Thank you. Thank you for this opportunity to share my passion. From the beginning, I knew I wanted to be in healthcare. I mean, I think the human body is just fascinating, and to be a healer and to help people, all of the traditional things. And I was lucky enough to work in an orthodontist office when I was in high school. And the dental hygienists that were in there, it didn't look like a hard job. It's like, oh, I could do this and and then I went to hygiene school and I was like, oh, this is a lot harder than I thought it was going to be. But it was still healthcare, and I looked at it as an awesome opportunity to be a healer. And then I graduated and I got a job and I became the cleaning lady. And
let me just walk back real quick. What were some of the challenges in learning hygiene? What were some of the things that stood out in the educational process that were significant hurdles?
Well, it was a lot more in-depth and more scientific than I had really anticipated. I had no idea. I mean, I went in blind. I had no idea what a hygienist did, really. The hygienist that I had gone to as a kid, picked and poked and polished and sent me on my way. And it's like, I can do that. That looks easy. And then it was all the science courses.
So wait.
Go ahead. I'm sorry.
No, I was going to say on the science end. So you learn all of the science. And then at the end of the day, you said that you became the cleaner.
The cleaning lady, yeah.
Why is there such a disconnect there? That's really what interests me.
Well, and that's what drove me to become a biological hygienist, because, and it's a sad thing because as a hygienist, my first year, I saw 10 patients a day. I felt like I was on a treadmill, just whipping people in, whipping people out, throwing a toothbrush at them at the front desk and saying, brush more and floss more. And I'll see you in 6 months. And maybe that bleeding will be gone. And we don't have the opportunity and the time to educate and to be a healer in a traditional dental office. You're busting people in and out because that's what insurance covers. And if you only do what insurance covers in dentistry, you're never going to be healthy. And we don't have that luxury of, the science, all the science we learn, the microbiology and the muscles and the anatomy. We don't use that.
Yeah. Why do you learn all this stuff and then not use it? That kills me.
Yeah. Well, it killed me too.
Yeah. Okay. So what is a biological hygienist? Tell us about this.
Yeah. So I left dental hygiene after 1 year. It's like, I'm not a healer, but I did, as I was getting my master's, I worked as dental sales, and I walked into a dental office that had a phase contrast microscope. And it was like light bulb moment went on over my head. It's like,
Yeah.
what is this? And how do you use this? A microscope, this big, beautiful piece of equipment in the dental hygiene operatory. And I looked at it and it's like, oh my gosh, can I have a job here? Because now I can see the pathogens. I can see a way forward. I can see how to be a healer and dealing with the root causes. I mean, it was at least the start of the root causes of dental disease. It's not just about oral hygiene. It's about the body and how the body works and how we harness the immune system. And why is that plaque dysbiotic? And it was an incredible light bulb moment. And I've been using a phase contrast microscope since 1985.
That's amazing.
And,
That's amazing.
it changed my world. I will never go back to not testing the plaque and the biofilm because I need to know, what's happening. Is it bacterial? Is it fungal? Is it viral? I mean, I can't see viruses on the phase contrast microscope, but from there I can go to salivary diagnostics and get an even bigger picture. Is it cytomegalo? Is it Epstein-Barr? Is it herpes simplex? It gives me a window into the body. And that's what a biological hygienist is. I'm looking at the root causes of dental disease, the bleeding gums, tooth decay, gum loss, bone loss, recession, malocclusion. Those are all just symptoms of way bigger systemic issues.
Yes.
And if I'm only the cleaning lady, then, that's not a healer. That's not, I'm not doing anybody any good because, I am a great plaque cleaner and calculus tartar remover. I love picking. Dental hygiene is made for me. I love picking. Just let me in there.
Love it.
Every hygienist does that.
I assume you got a job at that office?
I did. I worked there for 3 years.
So when you're just starting out with a phase contrast microscope, which by the way is my best friend as a microbiologist, that's my favorite activity right there. What do you do in the chair with a phase contrast? Are you staining? Are you encouraging the patient to come along with you on this adventure? What does that look like behind the chair?
Absolutely. I mean, that is front and center of what I do to enroll the patient. So I look at the perio chart. I'm looking for the deep pockets. And I am going to the base of the pocket with my little trusty scaler. And I'm getting a sample of plaque from the tooth surface, the base of that pocket. And I put it on a slide with saline solution. And I go to all 4 quadrants. I'm looking for the good stuff. And then I put a slide cover on, seal it up, and let it sit for 10 minutes so that the slide fluid just calms down. And then we go and look with the patient to the monitor. I put the slide on and the patient discovers with me what I see.
I love that you use the word discovers.
Well, it is a discovery. It
Yes.
is. It is exciting to see, is it healthy? Is it dysbiotic? Are there parasites on there? Do I have amoebas oozing across the screen?
Yikes.
Periodontal disease is
Messy.
wild and crazy.
Yeah. So on your patient side, what are some of the reactions that you get from these patients?
Oh, especially the first time, the look on their face. I love watching that because they are the first thing they say is that nobody's ever showed me this.
Yes.
Nobody's ever talked
Exactly.
about the biofilm and the bacteria and the fungus and the parasites that live in there. And then the next thing is, what do I need to do today to make this go away and heal? And then I want you to see my husband and I want you to see my kids. And how soon can we get started?
Yeah, they're eager. They're hungry, aren't they? Yeah.
They're so motivated.
That's so interesting. And that test is just the cost of the slide, essentially.
Yeah. It's like 42 cents.
Yeah. That's incredible. That's a huge power move for you behind the chair because it gives you instant authority.
It does. And then I love when they come back in, they have done their homework and I can show them, the bleeding's improved, the pockets have improved, the tissue is healthy, and the microscope changes.
Right.
And they're like,
Yes.
oh my gosh, where are all the bacteria? I was like, we did it, good job. I have proof that, this works.
So, okay, I'm going to stop here. And the reason is because you can just show people and get a buy in for, I'm going to work harder. I'm going to do something different instead of just throwing a toothbrush at them and, see you in 6
Yes,
months. But are you treating differently depending on what you see under that scope?
absolutely.
Okay, what does that look like? What are some of the cases that have come forward and even the healthy ones? Like, what is your discussion and what does that look like?
So the microscope for me is a screening tool.
Yeah.
If the slide is healthy and empty, great. Continue whatever you're doing, your supplements, your exercise, your stress. Gum disease isn't just about oral hygiene. It is
Right.
about the whole body. It's about your hormones. It's about your, chronic stress. It's about sleep. It's about proper breathing. It's about, what you're eating. Are you eating sugar? So we have to dive down into that. And, that's where the microscope, it opens the door to the rest of the systemic health. And a healthy slide, those people are eating well, they're sleeping, that maybe they're mouth taping so that they're breathing through their nose all night. Great. I want them to continue. When I have a disease slide, that is just a whole different animal. It's spirochetes just swirling around on the slide. It is amoebas eating the white blood cells. I mean, it's just it's a crazy, crazy dance of these pathogens. And from there, I want them to come back in. Let me disinfect those pockets. Let me use ozone. I use ozone gas, ozone oil, ozone water, and I'm helping just reset that microbiome. But then we've got to also address in the body. Why is it dysbiotic? What is happening in the immune system? Is there enough oxygen in the mitochondria? Are there hormones out of whack? I see a lot of slides in like 45-year-old women who are heading into menopause and their gums bleed like crazy.
Right.
And there's not a lot of bacteria on the slide. And so that's where we go to salivary diagnostics. So the slide opens that door. Is it bacterial? Is it oral hygiene? I mean, a lot of these, especially women, they are dedicated to their oral hygiene. They are flossing, they're brushing, they're doing, if I said stand in the corner and spit wooden nickels, they would. Whatever it takes to get healthy. But yet, the slide says it's not bacterial. So then we've got to enroll their primary care physician and get, what's happening with their hormones or their stress or their gut health or, sugar and what are they eating? And so that's the beauty of this wonderful tool.
With the perimenopause patients, what are the trends that you see there when you look at the slide and it's not a bacterial story?
Well, I see heavy bleeding. I see a lot of white blood cells on the slide and very few bacteria. That's what I see clinically on the microscope. And then what I see in the mouth is inflamed tissue, recession, mouth breathing, signs of sleep apnea. They're starting to gain weight because they have sleep apnea. And I see a downward spiral. If I didn't have the microscope, and I wasn't a myofunctional therapist, I'm looking at airway. If I didn't know that, I would just be yelling at them to floss more and brush more, that you're slacking.
Right.
Right. They are. I mean, they're brushing, they're flossing, they're using, whatever tools somebody else has given them. But we've got to dig deeper.
Yeah.
Because they have recession, they're breaking teeth, they have tooth decay, they're heading down a path that I want to pull them back from and say, hey, these are the warning signs. This is starting in your 40s. It's going to show up in your 60s as broken teeth and lots of crowns and maybe some brain fog and dementia and stroke and that path. And we have to look at airway is just as important as tooth decay and gum disease.
Absolutely. So, say I'm a regular patient and I am moderately healthy, and you've pulled my slides, and it is mostly okay. And one day I come in and you pull a slide, and there are these giant, fluffy, fat cells that look maybe like yeast. This would be fungal, right?
Okay. Yes.
What is my treatment plan? What am I looking at? What should I troubleshoot? What would you tell me?
So yeast like sugar. So I'd start looking
Yes.
at your diet, and I would start talking, maybe we need a nutritional analysis with a functional nutritionist, because that's not my lane. But most of my yeast patients have really good oral hygiene. But now, what has changed in your diet? How are you sleeping? A sleep study might be indicated. Are you mouth breathing? Because mouth breathing is huge, and snoring. It dries out the plaque. It makes it more dysbiotic. It makes it harder to get off the teeth. It becomes really thick and sticky. And how do we get this off better? So I would change your toothpaste to
Right.
a more biofilm busting toothpaste. I would talk about ozone, because I want to get the yeast out of there. But it's also, if you're yeast in the mouth, you're yeast in the gut.
Right. And maybe elsewhere.
And elsewhere, yes, throughout the whole body. So, that's where, again, the
Yeah.
biologic aspect of dental medicine, because it is medicine,
Yeah.
needs to incorporate a primary care physician or a naturopath or a functional medicine doctor, because this is my wheelhouse, the mouth. But this is just the beginning of the digestive tract.
Right.
So it's all connected from one end to the other. And we can't heal this without healing the gut and the intestines.
I would
And
argue that you can't heal the gut without first healing the mouth.
they play off each other.
They do.
Because this, the mouth reseeds the gut. And, and then if the gut's not healthy, you're not absorbing your nutrients.
Right.
So your mouth's not going to be healthy. So we got to do it at the same time.
Yes. Yeah. Agreed. How much support do you have with I assume you work with a dentist.
I do.
What is that relationship like? Tell us all about that.
Oh, that's a great question. For 30 plus years of my hygiene career, my first 36 years, I worked in an allopathic traditional dental office, and I felt like the lone wolf just barking up the wrong tree. And I was like, I know I'm in the right direction, but I didn't know biological hygiene existed. I had no idea, but I knew enough to know that where do I look for support? Because nobody's talking the same things I'm talking about the bacteria. They're just busting those patients in and out, and the doctor's like, patting me on the head saying, yeah, you're fine, but you got to produce more, and you got to be faster, and you can't talk so much because we're behind schedule. And then I luckily left that practice and was like, I need to find my people. And that's when I stumbled into a biological office, and it was such an eye-opening experience. And I never looked back, because at that point, they got me, and they understood the microscope, and I got them, and looking at the whole body.
What was the pivotal change in them that caused them to practice dentistry different?
Being curious,
Yeah,
and questioning. Why are we doing mercury silver fillings when we know mercury's toxic?
right.
Except when we put it in the mouth, which is 6 inches from the brain. And, we're told in dental hygiene school and in dental school that once you triturate that mercury with the amalgam metal, it's locked in, doesn't come out. But we know it does. We know they're mercury vapors, and we know mercury is toxic. And even plastics, we know now a lot more than we did then. We know that the pathogens in the mouth don't stay in the mouth. They travel through the body. They have found, spirochetes from the mouth in the synovial fluid in joints connected to rheumatoid arthritis. They have found spirochetes in the heart, in the atherosclerotic plaque, and
Yeah.
in the brains of 93% of dementia patients.
Right. And not just the spirochetes, but all sorts of oral
Oh,
bacteria.
yeah.
It's not alone. The spirochetes are just easy to see in the microscope.
Yes.
They're these little corkscrew cutie guys. That
And they are
not
so
cute in
aggressive.
that you don't want them to be there, but they're really
Yeah.
easy to identify, and it makes everybody's life easier when you can just see it and treat it.
Yes. Yeah. I had an 8-year-old yesterday. I took a video of it, and I'm going to do a little blog post on an 8-year-old with these aggressive spirochetes. And it's scary. It should be scary.
What other issues does this 8-year-old have? Do they have any gut problems or?
Um, Probably yes. I mean, because what 8-year-old eats properly?
Fair.
They have airway issues. They're in orthodontics and expansion.
I
So
see.
you've got teeth that are hard to clean because we've already got appliances to expand the palate in there. But luckily, the mom understands the value of getting a biological office on board. And
Perfect.
they're working on it. But this was their first appointment as I hate to say the cleaning, but a hygiene visit, because they had been to traditional. And
Of
so they
course.
got to buff and go.
Yeah.
It's just, get that plaque off with little pumice, little sand, and I'll see you in 6 months. And by looking at the microscope, again, we have that buy-in from the parent. It's like, what do we need to do? And how do we do it? And, the importance of getting these pathogens out. I went looking for research to see if early onset dementia is connected, if there's any childhood connection, but, nobody's testing these kids and then looking, at 30 and 40-year-olds with early onset dementia. It's like, we need to look.
Yeah, it's hard to get the valuable data not knowing if your patient is headed that way or not. And
Yeah.
then once they're there, then it's a whole different problem. So, for example, a lot of the dementia patients, when you finally get them, do you have the right history to pull from? That becomes a problem. And then just dementia patients in general have poor health because they don't remember to do their oral hygiene, of course.
Yeah.
And then who's doing their oral hygiene? I mean, that's
Nobody.
once they go into care, nobody. Yeah, it's just
Zero.
horrific. Yeah.
Zero.
But I do know for Parkinson, which heavily weighs into oral health as well, with Parkinson's patients, the first indicator would be constipation.
Oh.
And of course, not everybody with constipation develops into Parkinson's, but certainly when you do the evaluation, once they're starting to have early onset, you can see that a majority of these Parkinson patients were constipated first. It's just part of the pathology. And of course, constipation isn't necessarily hand in hand with oral health, but it certainly has that circular route in the body. Once you're constipated, it's going to affect your blood. Your blood's now going to be altered because of that inflammatory process that is happening in your colon. And then it's going to eventually get back to the mouth and it's not going to go well, right? And so you have to solve all the problems to make sure that you're protected in the future. Yeah, it gets tricky. Once you're in dementia land, it becomes a really complicated puzzle.
Oh, and it's so sad. I mean, it's heartbreaking. And, I want dental hygiene as a profession to elevate, to be that brain health hygienist. What part do we as a profession play? And I think we play a big role in that.
I think we could. Yes. I think we could. And that's a great way to pivot into where you're currently moving, and that is education. Tell me what inspired you to go into education and how you're expanding in that direction.
Thank you. Dental hygiene as a profession is under attack right now.
Yes. Tell us more.
Yes, it is. In several states, dental assistants are now allowed to scale teeth.
Right.
So they've already been polishing. They have expanded duties where they can place fillings. Even in one state, they are looking at allowing dental assistants to administer anesthetic to numb.
And who is training them?
On-the-job training and weekend courses.
So that's
So
the dentist, or is that a hygienist training them?
a dentist. A
Yeah.
dentist would be training them.
Do you think personally, do you think dentists are going to be good at teaching hygiene?
No, I do
What
not.
tell us more. Tell us more. I want details.
Okay. I mean, dentists get, like 6 weeks possibly of, how to scale teeth. And they're not focused on prevention. They're
Right.
focused on, mechanical repairing teeth. And when a dentist has a full schedule of patients, he or she does not have time to sit and show a dental assistant how to properly scale.
I just want to say that my dentist, I asked him specifically about this as well because I was
Uh-huh.
curious what his reaction would be. And he was like, absolutely, I should never teach hygiene. This would be a
Yeah,
terrible idea on all fronts. It would do nobody any good. I wouldn't be able to teach in depth on this
yeah,
at all. And
exactly.
superficial discussion at best. And I thought I was grateful that he was so honest, but I think that that is true. I do appreciate that we have a significant shortage of hygienists in some areas. And I can appreciate the desperate offices that may be in these deserts. They're doing what they see as the best fit, right? And I don't
Yes.
know what the right solution is. I think that they're just trying to survive, quite frankly. But I do think that there are so many ways to bolster hygiene in general that creating programs on the back end to support the dentist more meaningfully would be a much more sustainable effort, to your point.
And I agree. When I look at dental hygiene, I think there should be like levels of dental hygiene, like nurses. Let's have that entry level. Great. That's the kind of hygienist you want to be and you want to pick teeth, go for it. But, there should be another level, like a nurse practitioner. And I like to think of myself as a biological oral health practitioner, which is a mouthful.
Yes.
But that's where we need to go and not compromise patients' health.
Right.
I spent 2 years, hard years in dental hygiene school, and I did a year of prerequisites. And now they have 2 years of prerequisites and then 2 years of dental hygiene school. And to come out as this well-educated prevention specialist and oral health practitioner is what we really are. And that's where I want to see our profession elevate. Yes, go ahead, pick a little, poke a little, and then refer them to me if they're not healthy. And 90% of the population is not healthy.
Right.
When I look at new patients, I see bleeding, I see pus, I see mobility, I see worn teeth, I see a need for my skills. And if they're healthy, great. That's super. I want to maintain them, keep them that way. But most people, 90% of the population has some level of dental disease. So to short circuit that with a weekend course of pick and poke and, see ya because your insurance doesn't cover, your health, it breaks my heart.
Yeah. Us all. Yes.
And so that's where biological hygiene, I want it to be front and center of how we treat patients, to really elevate. And hygienists should have autonomy, and I should be able to have my own practice and put my shingle out there because I'm teaching and elevating and educating and practicing. My dentist, I love her. I love all the dentists I work with. They support me, and they are biological and they're airway focused, and they let me do my thing. And I don't need somebody looking over my shoulder. I'm not harming anybody in any way. And I am educating and elevating my patients. And my patients are the healthiest I would put them up against any practice. And then, to educate the whole profession because they, like me, I was a voracious reader. I read every dental hygiene magazine that came across my, and I never did they talk about biological hygiene in there. And once I found it, it's like, why is this not standard of care?
Right.
Why are we just still focused on a piece of calculus, piece of tartar. It's not the tartar. Tartar is there because we have a nutritional deficiency. And bleeding gums are because the body immune system. So that's the importance of looking at the whole picture and reconnecting the mouth and the body back together. And dentistry has separated them. So my training, my two bio besties, Fran Horning and Catherine Gilliam and I, have started something that we call Boost Oral Health Institute. And BOOST stands for Biological Options for Oral Systemic Therapy. So Boost Oral Health Institute. And we've got a little play on words because OHI, which are the initials of Oral Health Institute, we teach oral hygiene instruction, OHI. So when I write in my notes, OHI, I have taught them brushing, flossing, tongue cleaning, irrigation, all of that. So Boost OHI is our new institute for training both dentists and hygienists how to incorporate the whole body.
So are your partners in crime here two other hygienists, or is one of them a dentist?
Correct.
Okay.
So nope, they are both biological hygienists, and they are as geeky and as wonderful and as curious and as inquisitive as I am. And we fit together perfectly.
I love that. How do you tailor your work toward the dentist? How do you get a dentist subscribed to what you guys are doing?
Oh, our latest talk was in New Jersey. And because in New Jersey, every dentist has to renew their license by the end of October.
Yeah, CME.
And so it was mid-October, and we happened to offer this in training 2-day course. And these 8 dentists who had no idea what they were signing up for signed up because they needed 16 hours of continuing education. And we started talking between Fran and Catherine and I. And it was wonderful because you could see the light bulbs go off over their head.
I'm sorry. Did you use predatory CME practices to grab them? Because I find value in that. That's amazing.
It was lucky. Sometimes you just get lucky.
Very cool.
And to each of them came up to each of us at the end and they said, "Oh my gosh, I had no idea."
Amazing.
I had no idea this existed. And I want you to talk to my study club. And I want you to come to the hospital where I teach and talk to the interns. And it was, they got it once they understood. But there is no other training like this unless, there are 3 holistic biological organizations: the International Academy of Oral Medicine and Toxicology, the IABDM, which is the International Academy of Biological Dentistry and Medicine, and then the Holistic Dental Association. So if you wanted to learn, you have to be curious and go investigate those places, and become a member and take their courses. But there are no courses out there just to say, hey, pay attention, be curious. Let's talk about this. It's not woo-woo dentistry.
Right.
I'm not sitting there rubbing crystals over somebody's head and chanting. It is all science-based. I have research. Everything that I do, I can back up with lots of research. I mean, that's the thing with the IAOMT is it's all scientific research-based.
Right.
And we have the receipts and I have the proof and I have the science to open up the door and just say, hey, let's look at dentistry differently because tooth decay is at epidemic levels. And I think that it's like 60% of kindergartners have a cavity. What are we doing wrong? What changed in our diets? Why are, 90% of kids by the time they're 18 years old have braces? Why are faces not developing properly? We have to be curious as a profession, and we have to dig way deeper than just buff and go, drill and fill, and patch those holes. Why are teeth melting? Teeth are the hardest substance in the body, and yet they're dissolving.
What do you think changed in the child diet of today?
processed foods, carbohydrates, mouth breathing, lack of nutrients, lack of gut integrity. We're not absorbing our fat soluble vitamins. Our kids are mouth breathing from birth, and the jaws are not developing properly. We have malocclusion. We don't have room in the baby dentition for permanent teeth. And when you have malocclusion, now you have plaque traps, and it's a downward spiral, and then we wait till they're 13 or 14, and then we put braces on them and we extract teeth because there's no room for the permanent teeth. It's heartbreaking. And so now we've got a mouth that is too small for the tongue. So where's the tongue going to go? In the airway. So now we've got sleep apnea, and then we have clenching and grinding. And so teaching, just when we taught these 8 new dentists to biological dentistry, just to see their eyes pop open, it's like, oh, I get it. That's where we really need to educate the rest of the dental population.
Agreed. The dentist is a stickler for the hygienist who wants to do this type of work. And this is why I'm sitting on this moment where you positively impacted 8 dentists and you were invited to do more work with them. My question is around, do you show monetization, or are you just simply showing simple methods to highlight and capture the patient's pathway to health?
So, I mean, we have to be able to make money at this. We have to be able to
Yes.
pay the bills.
That's always the pushback from the dentist, is like, oh yeah, this is all great and fun until, you're in your operatory and taking a long time looking at a microscope, right?
Yeah.
Right.
Well, showing the microscope slide actually does not take very long.
Right.
3 minutes. That's all I need at the microscope. And I have buy-in. I have, sign me up. What do I need to do? I'm ready for gum therapy tomorrow. Can you get me in? So
it's such a cheap way to get a patient invested in their own health. I agree. I don't see a problem here, but
yeah.
I know I've heard the pushback. I've seen dentists cringe, nobody has time for this.
Yeah. Well, and that's where, we have to educate as an academy. We need to get out there and really engage those dentists and say, hey, this does not take long. Let me show you how fast we do a slide. It takes me 30 seconds to do a full, patients don't even know I've done a slide because I take that plaque sample and I'm doing my oral cancer screening, and it's the slide is off to the side and I am moving on. And the patient asked me at the end, so did we do that plaque sample today? It's like, oh yeah, I did that at the beginning. And so I'm looking at it at the end. And that's how I wrap up before I walk up to the front desk and say, okay, I want to see you for 2 hours. And remember that water pick I talked about and the ozone I talked about, and I just wrap it all up with the microscope slide. It's like the icing on the cake, because I've already showed them the bleeding. I've showed them the broken teeth or whatever's going on in their mouth. And I've already written down my recommendations, what toothpaste, what toothbrush, what we need to tweak to improve their oral health.
What are some of your favorite products in this space? I heard ozone.
Ozone for me is the Windex of dentistry. It just does everything.
Yeah.
And there's new ozonated glycerin. And oh my gosh, does that taste good? Finally, it doesn't smell and it tastes good. Woo! It does. Because ozone is
taste is a huge issue. Yes.
Yes, it is. I get patients who say this smells like wet dog.
Yes.
So it does. It does. But, it works. Ozone is super oxygen. And that's all ozone is. It is harnessing nature's best cleansing agent. And we take that ozone gas and we percolate it through oil, or we percolate it through glycerin now.
Right.
And I can put that in the pockets and I can bust the biofilm. I can kill the bacteria, the fungus, the parasites, the viruses instantly. And I can send patients home with jars of ozone. So they
Right.
can put it on their toothbrush, they can put it on their floss, they can put it on interproximal brushes, little soft picks, and work it in between their teeth so that they can disinfect every day at home. That biofilm, as you know, Camille, is going to repopulate in 24 hours.
Yep.
I can clean with the best of them. But 2 bacteria become 4 bacteria, become 64 bacteria, become a gazillion bacteria in 24 hours if we don't change something.
Right.
So having ozone is a game changer for me. I like water flossers because that's the only way you're going to get into the base of the pocket. And that's where I use chlorine dioxide in the water pick. I use ozone water. I want a disinfectant, something that busts that biofilm.
So do you give them supplements for their water pick to add to their treatment?
Well, yes. I mean, that's where an ozonating water pick, a Viajet. I've got a Viajet that makes ozonated water. I've got ozone water making machines that they can purchase and use at home that are reasonably priced, about $200, so that we are disinfecting on a daily basis. And ozone is my go-to. I used to use baking soda in the water pick, and I still occasionally will recommend hydrogen peroxide. The problem with peroxide, because again, it's oxygen, is that I need a lot of peroxide. I need a 1.5% solution of peroxide. So that you're taking a 3% peroxide and you're diluting it 50%. So you're going to go through a lot of peroxide. So can you buy peroxide in the gallon jug? Because if you're using, 200 milliliters of peroxide and then 200 milliliters of water and you're irrigating with it, you're going to go through a lot of peroxide. And then what else do I use? I like chlorine dioxide, but again, I just come back to the most economical is ozone water.
Right.
And I certainly love electric brushes. I own 7 of them because they all do different things for different people.
Sure.
Yes. If I need a gentle one, I do a Curaprox. If I want one that just busts the biofilm, I love the Sonicare. I have one called the QE or the Curvy, which is a different angle. And, again, it's unique and it gets in the nooks and crannies and I love it. And then I have another super soft one from Supermouth that has a UV.
I love that one, by the way. It's fun.
It is. It's great. And it has a UV light that disinfects the bacteria in the brush. I mean, all these toothbrushes all have bacteria in them.
Yeah.
Imagine that.
Yes.
We just took it off the teeth and now it's in this wet, soggy bathroom and you're just going to put it back in the mouth? No, we've got to disinfect the brush. So they each are unique and they each do different things. And I try and customize, what I look in the patient's mouth, what I recommend. And that's why I own, 7 of them because I'm testing them all out.
Absolutely. Yeah. Mm-hmm.
So, and I even will recommend a manual toothbrush, but I want people to use it as a dry brush. A nice, gentle, dry brush, no toothpaste, no water, and brush until your teeth feel and taste clean. Then put some toothpaste on, brush, spit, rinse. So that's where I try and customize it. Just some people do not like electric brushes. All right. Do you still use a rotary phone? Let's join the 21st century, but there's different, a pot for every cover and a cover for every pot, as my mother would say.
Right.
So I customize it. Water flossers, absolutely. Tongue cleaner. Nobody's talking how dirty the tongue is. And we should be cleaning the tongue twice a day, every day. There's plaque on the tongue. And that's the thing I do last is I show the patient, I ask permission, may I clean your tongue? And I get my tongue sweeper out, scrape that tongue and show them all the plaque that's on there. And I've even taken plaque sample from the tongue and put it on the microscope and it's full of pathogens.
So the tongue story is interesting to me because there's been all that research in nitric oxide production. Most of our bacteria that are breaking down that first part of creation of nitric oxide, which is nitrate to nitrite, happens on the tongue.
Yes.
And so there were people cringing at too much tongue bacteria disruption. I think of it as like in the morning time to get off all of those hopefully anaerobic bacteria that have been sitting in your mouth with your mouth closed all night. But then I have stopped doing it in the evening. Tell me I'm wrong.
I am going to tell you you're wrong. I want,
Okay.
because the pathogens, I mean, the plaque is so sticky and it coats the whole tongue.
It does.
I want the good bacteria to take over. And when you have, you've eaten dinner, you've got carbohydrates in there, and that's the bad bacteria, the fast eaters that are munching on your carbohydrates from dinner. And I want to get that off your tongue. I mean, when I clean the tongue, half the time it looks like I'm taking peanut butter off of somebody's tongue.
Yes. Yeah, I know.
Yeah. So I want the good bacteria that are at the base of those follicles to have a chance.
Yeah. Okay, so we talked about toothbrushes and tongue scraping and ozone. What other products should I be using?
Well, I mean, that's where from here we have to customize.
Right.
Do you have sensitive teeth? Let's talk about floss. Floss, I mean, dentistry and dental hygiene is clutching that floss, man. Like it's your lifeline.
Your favorite is Glide, right?
Yeah. Yeah.
Sorry, I had to.
Yeah. I mean, the problem is that it is the public's favorite floss.
Yeah. It feels great, right?
Yeah, it does. It just slides right in there and not a problem. But the problem is, for me, it slides right over the plaque and it leaves it there. It does not engage. Glide floss removes food debris. Hallelujah. And I want the food out. But when I use disclosing solution, so when I'm with a patient, I use a tricolor disclosing solution and I paint this gel on and then I rinse it off. And new plaque that's less than 48 hours old will be pink. Old plaque is purple, deep purple. And then acidic plaque is baby blue or some shade of cadmium blue. And then I show the patient there. And then I will take Glide floss and I will floss. And it doesn't disrupt that purple or the blue because it's really sticky. I mean, plaque is almost like an igloo. It wants to live. It's alive. It is thriving. It has a vested interest in maintaining its home in your mouth. And so it makes like a lipopolysaccharide shell that is almost impenetrable. I've taken a toothbrush and shown people, just brushing, I can't get rid of that purple or blue. And I show them how long it really takes to get plaque and biofilm off their teeth. And it's like a good 30 seconds before I have even penetrated into that biofilm. It wants to be there. And so if you don't get all that biofilm off every 12 hours, the plaque regrows because it's alive. The bacteria are pooping acids on the teeth. They're spewing lipopolysaccharides. They are growing. They're procreating. They are, right? I mean, it's,
yeah, absolutely. Yes.
Yeah.
Having babies.
Yep, they are. They're having bacteria babies and they are just, they want to live underneath your tongue and they are eating, the sugar that you're giving them. And so the more carbohydrates you eat, the more they grow. And by mid-afternoon, your teeth feel like they have fuzzy little sweaters on because you didn't get the plaque off after breakfast. And then if you are mouth breathing, now you have thicker, harder plaque to get off. And so it just grows and accumulates. So showing them how hard it is to get all the plaque off. That's why I like dry brushing, because it's a little bit stiffer, a little bit firmer, and I get a little bit more plaque removal. And then, Glide floss glides right over it, leaves it right there. So I need a woven textured floss, and I need really good technique. Flossing is really technique sensitive. It's not just whipping the floss in and out as fast as you can. It is rubbing the side of the tooth underneath the gum with control, precision, and rubbing 10 times on each side of each tooth to have a chance to break up that plaque biofilm because it is so tenacious. So, that's where, again, spending the time with the hygienist, learning, holding that floss yourself and learning how to floss properly, because it is so technique sensitive. And if you don't do it right, you're cutting your gums. And now we have gum inflammation because now we've got damaged gums. So is floss the be all end all? If you do it properly, hallelujah. But it only goes, 2 or 3 millimeters under the gum. And if you have a 4 millimeter pocket, you still have a millimeter, which is like the Grand Canyon for bacteria. And it's party centric.
Yes.
So, different tools clean different parts of the tooth. So the toothbrush cleans the flat surfaces, which is about 60% of the tooth structure. Then you've got 40%, 20% on each side. And then you've got the pockets. So that's where the floss,
Water
the
flosser?
brush, the water pick, I love Perio Protect trays.
Do you?
Because, you put that peroxide gel in these custom trays, wear them for 20 minutes, you're busting the biofilm, you're getting peroxide into the base of the pockets, and we have a chance to help the gums heal.
There's been a bit of divisive discussion around the Perio Protect, mostly around the outgrowth of Porphyromonas gingivalis. What do you think of that discussion?
Everything in moderation.
Fair.
I don't want to rely on these trays forever. But if it can jumpstart the healing, because again, why is that bacteria dysbiotic? Unless we address the root cause, we're going to be in those trays for 16 years. I want them like 2 or 3 months, and then I want them off the trays. But we've got to deal with, how do we support the immune system? How do we support the mitochondria? What is going on that's causing the dysbiosis? So
when I'm looking at the data, I'm seeing an outgrowth of Porphyromonas gingivalis, which, we know if you have very sensitive tools that it's going to be in anybody's mouth, whether or not you have pathology. And I know as somebody who studied that bug for a good moment that it really changes metabolically when there's inflammatory process at hand, and it changes the whole way it does business. And so when there is pathology and there's a lot of that bacteria, it is not a great combination because it feeds forward that inflammatory loop. And so I would not hesitate to use Perio Protect, but I'd more like do it for a couple days and then hit it with something else, just to like cycle out, because just that much PG it worries me for a lot of other reasons. It has the capacity to feed forward this inflammation loop that we know is involved in arthritis and Alzheimer's and cardiovascular risk. And it's in all of those places. So I start to get like real uncomfortable in that space.
Well, see, this is where I'm like, ooh, ozonated glycerin in those trays.
Yeah, I'd love to see a study. Is there a study?
Not yet.
Are you going to do
what?
one?
We couldn't use ozone oil in those trays because the oil and the ozone compromise those trays. But it's like, well, I wonder if we could use ozonated glycerin.
I do too. I know glycerin on its own is anti-inflammatory. Glycerin, when you put it in a formulation, does have degradation products that are inflammatory. So I do wonder about the stability over time in those formulas, but I certainly think that it's a better bet than having an outgrowth of PG for too long.
And I support that absolutely, because PG is the keystone pathogen, and PG's best friend, as you know, is the spirochete, and so they work together, exponentially being destructive. So it does concern me, and I need to read that research.
I can send it over.
Please. Absolutely. I want.
Have you done any clinical studies? Is that something that you're going to do with some? You have cases, I'm sure.
Well, I want to do actually some clinical studies on tooth decay with a tool called the Crystal Care Remineralization Strips, because I'm really focused. I'm doing a deep dive into dental caries disease, tooth decay, and how do we reverse early stage tooth decay. And we've been using a product in the office called Curodonts. And so
Yes.
Curodonts are a peptide that we prepare the tooth structure, ozone it, etch it, and then we flow this peptide into these early tooth decay. So they're still in the enamel, not into the dentin. And we get about a 50% remineralization and reversal of tooth decay with this. And I'm like, how do we make this better? And I've connected with the Crystal Care remineralization strip people because they're a little startup. They're brand new. And remember when Listerine came out with those little breath things that you put on your tongue and it melts?
Yes. And they
Okay.
gave them to dogs and
Yeah. These strips are just like that. They melt as soon as they reach saliva. So I want to be able to put this on the teeth that we've just done the Curodonts on and then check them again in 6 months. So that's my future coming up in 2026 case studies, because I want to see us go from 50% success to 100% success with early dental caries. We can make such a difference if we, again, address the diet, the sugar, saliva. The best way to remineralize teeth is with saliva. And, our kiddos are mouth breathing, our adults are mouth breathing. So, how do we up the game to get reversal of tooth decay? Let's give them a foundation. And so that's the case study I'm looking at doing soon.
That's exciting. I love the direction there. So with stuff like Curodont, it's still kind of a small impact into the dental practice at large. Do you see that expanding? Are you seeing more and more practices taking that up? Or is it kind of a slow wildfire like biological dentistry?
Yeah, it is slow. It is. I mean, because, it takes time. And how do we incorporate these new things into a busy practice? Right. And that's where, again, just educating the hygienist to, be aware that this exists. And so I would, I'm working on it.
Yeah. How are you? I'm still going to come back to toothpaste,
Okay.
but
Okay.
how are you moving your educational program forward? Like, where can I find you?
Well, yeah, we don't have a website yet. RDH Boost is where we are on Facebook. And my blog is queenofdentalhygiene.net. And I have, a great website. I'm posting again. I'm writing again. And I've got lots of information there. And my email address is attached to my blog. And then I can direct people to Boost OHI. So we're still in the grassroots with Boost OHI, but we've got 2 dates that we are penciling in for 2026. And I'm happy to come to dental offices and just do one-on-ones. And I have a microscope. We'll travel and just educate, whatever it takes. I'm busting down doors here, trying to get dentistry to pay attention.
Yeah.
And,
I mean, if you're in Jersey again in October, let me know. I will crash your course.
Yay. I would love that. I would have you teach the microbiology course.
I would love to. Yeah. And I've done it before with others. I would be happy to do again. I love this space. You know that.
Yeah, I do. I have the microscope videos of plaque. Like I have so many. That's what I do in my, at the end of the day as I look at my plaque slides again.
It's your screensaver. Just cycling.
It should be, yes.
I definitely did that in grad school. I would have my slides come up as my sleeper screen. Oh, I'd love that. I'm
going to have to do that.
Yeah. Okay. So when we're closing out a patient and we're giving them the slide, they now know that they're going to be purchasing a rope floss. They are all dialed in on their medicaments and like ozone gel, potential water pick. You said not water flosser. And then my oral hygiene, say I'm normal, healthy. What's your go-to brand for that?
For toothpaste?
Yeah.
Toothpaste, I mean, toothpaste is cosmetic. honestly.
You said dry brush, so you're just really focused on debriding.
Correct. Whatever it takes to get the biofilm off. And
Fair.
so I send patients home with some disclosing tablets so that they
Okay.
can check themselves at home. And toothpaste, yes, toothpaste should be medicine, but it really isn't. It is cosmetic.
I would argue that no matter what toothpaste you're using, it is being delivered because you do irritate the tissues enough to get a drug delivery
Yes.
there.
Yeah. Well, and actually, yeah. And especially if the toothpaste has sodium lauryl sulfate, now you are abrading your gum tissue. If your toothpaste foams, you are introducing all of these chemicals into your system. And, a lot of toothpaste have really toxic ingredients, which concerns me. So is there a perfect toothpaste? I like to think I have better toothpaste. I like Dental Sidon. I like Revitin. I like Wellness. I like Supermouth. Oh, Supermouth makes a chocolate toothpaste. It is just
And I love him.
Yeah,
He's
I do
been
too.
on before.
I absolutely
He's
do.
great.
And
Mhm.
those are my favorites. And just because, they taste good and they are the cleanest products that I can find. And I don't want fluoride. I see fluorosis in almost every patient I see under the age of 60. And is it systemic? Are they accumulating from the foods that they eat? As kids, are they ingesting fluoride? All of it. And so I see that damage. And that's a whole nother hour topic.
Yes, we have covered fluorosis on the show. We have covered fluoride. I know we have a slight difference of opinion. It's not my favorite. I don't think it's a solution for everyone, but I do understand the socioeconomic impact that it could have if we don't have any solution in our pockets for people who are struggling. And it's a really mixed bag out there. So, I would like to just see a lot more solutions that we could pick from.
Well, and that's where dentistry has to level up. We can't just rely on fluoride as a one-trick pony. We have to look at, the airway, the sleep, the food, because otherwise we have the mouth and the body are disconnected. And they are all connected. And it's up to us to elevate and to really connect it and pay attention and be a true part of the medical systemic connection.
Agreed.
And if you're just relying on one medicine to solve your problem, it doesn't work. I mean, tooth decay is still at epidemic levels, and we have plenty of fluoride. We have so much fluoride, and it's toxic for me. And so that's why biological hygiene, it's dental hygiene's moment to shine and to grab and take advantage of all of this information and to really be that healthcare provider that we should be.
Right. I am really enjoying the practices that are experimenting with different methods of practice. So there's one in Manhattan that I've seen that is a subscription based. So I pay a monthly fee. I go in for as many cleanings as I need, and I get several treatments a year. I mean, this is just an option, but I just see like people getting creative because not everybody is going to have dental insurance available to them. So like this is just an ongoing quest for the right opportunities for everyone,
Yes.
I don't want biological dentistry to just be for the people who could afford it. I would really like to see a broad application. So I'm excited for your educational programs to get everybody invested, to get the dentist in the room.
Yeah.
I would encourage the predatory CME practices. I think that's a great technique if you just roll in at the end of the CME period. And
that's why we're going back in October.
That's incredible. Happy to help in any way. And I will send you my toothpaste just so you have the awareness.
I'm excited to try your toothpaste and feel it and taste it. And we need toothpaste as medicine. And not as a healing
options.
agent.
Yeah.
This is a wound. When gums bleed, it's a wound. And instead we're putting something in there that abrades the tissue further.
Possibly irritates it further. Yeah. causes ulcers potentially.
Yeah.
Yes.
Oh, yeah.
Yeah.
Absolutely.
It's rough. You think you're doing the right thing and you're making it worse.
Yeah.
How awful.
Yeah. Yeah. Canker sores, sodium
Boy.
lauryl
Yeah.
sulfate. Boom.
Well, and stannous fluoride.
Yeah.
It really harms up to 30% of the clinical populations that have been evaluated. It can really make them worse.
Okay. So there we go.
Yeah. Yeah. It's terrible. And it's not something that we talk about because we want to save fluoride.
Yeah.
So it's rough.
Well,
anyway, I really appreciate your effort in this space. I'm so excited to see what you do. I definitely want to play with you in the field.
Great.
And yeah, very excited. Thank you so much for coming.
Oh, well, thank you. Thank you for the opportunity to share my passion and for you guys to be curious and interested and so supportive. I greatly appreciate that because it has been a lonely journey.
Yes.
I understand
I feel that.
I know I'm in the right direction.
Are you going to be at RDH this year?
Yes. Yes. And I am speaking.
Excellent.
I've got an hour talk on ozone. Surprise.
Yes. I'll be there. We'll have a snack together.
Absolutely. Absolutely. I look forward to that, Camille. Thank you. Thank you. Thank you.
Jonathan usually closes us out. So take us away, boss.
So one last question we like to have with the people we're breaking bread with. Could you share any current media you're consuming or interested in, whether it's books? You said you were an avid reader. It could be TV shows, movies, music.
Well, I have to admit, I am a dental hygiene geek, so I am reading dental hygiene journals, research studies. I'm, as I said, I'm diving into tooth decay. So that's what I'm consuming. But the latest book on my nightstand is Atomic Habits. And that is, I'm going to take that on my cruise.
Clear. Yeah.
And just how to be healthy for myself and how to change all my bad habits.
Oh gosh, tell me how. I was actually just talking to somebody yesterday. I very much admire her. She is a Reiki master. And she was saying, I've been a healer for so long. I've transitioned so many people into a better place. And now my focus is on me. And so I love what you're doing here. Just healing others, educating, and taking a moment for yourself.
Absolutely. It is. I've been on my own health journey for the last year and a half. It's like, I want to be a healthy 100. I don't want to go down that chronic disease path. And, I have to take care of me first. If I can't take care of me, I can't take care of anybody else. So it is a focus of mine.
Awesome.
Excellent. Well, thank you so much.
Oh, thank you. Thank you.